what I understand is that Sutter Health is a corporate healthcare apparatus with profits in excess of $188 million a year and $90 million in tax cuts. Is FS has a troubled history with labor and at worst a suspect relationship with city developers and politicians. And it is the opinion of many within the Occupy movement that Sutter Healthcare's push to destroy St. Luke's Hospital by funneling wealthy patients into a new hospital and leaving the underfunded patients quite literally in the cold is reprehensible. We in the Occupy movement feel it admirable that the San Francisco Board of Supervisors, led by such informed and sympathetic officials as Mr. Avalos and Mr. Marr, can draft resolutions to end the war in Afghanistan, yet we consider it irresponsible to neglect the far more pressing local issues such as the Sutter scam, which will exacerbate conditions for our burgeoning mentally ill and homeless problems. Ladies and gentlemen, I urge you to revoke their tax breaks and frame your conclusions with a maximum of people, not profits.
St. Luke's was a very vibrant community in terms of multilingual speaking physicians, multi-specialties that were there when I joined St. Luke's 31 years ago. At this point, my question would be, how will Sutter actually maintain a vibrant hospital, something that can survive and be protective to the community? How are you going to get the specialists that may be required to be there as well? You can develop a primary care kind of model to try to refer people to other facilities, but that is not a vibrant hospital that's going to serve the city well. In the South of Market community, there is a major problem. Medicare is reducing its reimbursement. There are few people treating, even specialists are not keeping it. How will Sutter address that issue of finding specialists to treat whatever population, including medical health, to actually deal with this population?
My name is Dr. John Rouse, and I'm speaking on behalf of the Physicians Organizing Committee, and particularly those of us who work in psychiatry at SF General Hospital and the Psychiatric Emergency Service Unit, where I have been a psychiatrist for 30 years. I also pass on the analysis from our St. Luke's membership regarding the psychiatric services for which Sutter should be held accountable, as I am more free to speak than employees of Sutter Health. PES is the city's 5150 receiving unit where patients deemed to be a danger to themselves or others. Our job is to stabilize them and transfer them to appropriate facilities for follow-up. Those facilities are rapidly being eliminated, meaning our patients can end up back in the streets with no care at all. CPMC's plan includes 0 psych beds in their Cathedral Hill proposal and 0 psych beds in the St. Luke's rebuild. In regards to the highly touted Blue Ribbon Panel and Community Outreach Task Force meetings, the comments of our doctors on site were literally written out of the minutes. Sutter said that they can't be expected to solve the city's mental health issues and then ask for permission to effectively eliminate all their psych beds. CPMC pays no property tax on any of their hospital and office buildings in SF, yet they make over $140 million a year in profit from their SF operations. It is our position in this plan is adequate for the mental health needs of our city, and the Board of Supervisors must deny permission for CPMC to proceed until such time that they provide their lawful share of services with psychiatry for the top.
The effects of these mental health service cuts have been devastating. There's just less and less available. Programs that used to be available aren't there anymore. In the environment of budget cuts, it's essential that private non-profit hospitals fulfill their charity commitments. Sutter's long-range development plan, however, prioritizes maximizing revenues and achieves this in part by including only 16 psych beds in a hospital that's disconnected from the medical hospital, which limits what they could do, and will end up with more of the med psych patients at San Francisco General. So So basically, we don't agree with Sutter's plan to have only an 80-bed St. Luke's place, and we also really advocate for increased psych beds, having some psych beds at St. Luke's, because the capacity keeps going down. And just like there's concern about the SNF beds, with an aging population, with these Medi-Cal people coming in, they have more mental health problems than the employed higher income population. So we're going to need these mental health services. Thank you very much for your time.